should expect FaceTime. You should expect, even if they gave you a lot of time to begin with, now they're going to rush you out of the office every time you go back and see them. You deserve to spend as much time as you want with your oncologist, and they should schedule accordingly. So if you are not being taken seriously, after your cancer experience or during, you're not getting the FaceTime that you want, it may be time to get a new oncologist. There's nothing wrong with getting a new oncologist even after you're done with treatment. So do keep that in mind. You want a doctor that's going to continue to explain to you as you progress through this cancer journey, the scans, the diagnostic test, and the lab reports. So somebody who's going to say, this tumor marker test indicates that you are, still within the appropriate range, or your white blood cells are out of range now, and here's what we want to do about it. You shouldn't have to ask those questions. They should be the ones that are bringing those things to your attention. As a cancer patient, you will at some point probably get scans for a long time, if not for life. So you should expect to get monitored for a while until you have a decent period where you've had no active disease. Or in my case, I'm monitored for life. But for early stage patients, for about 5 years, I'm monitored about every 6 months. I'm getting a scan to make sure that there's nothing coming back. So if they say, you're done with treatment and you don't have to ever get a scan again, I'd be really skeptical of that. A good oncologist, again, considers treatment advances. They're not going to rest on their laurels and say, okay, well, the standard protocol is chemotherapy plus this and this. There's a lot of new immunotherapies that are being developed nowadays that are less toxic and really have a better efficacy rate than a lot of the cytotoxic chemotherapies that we have experienced in the past. So quality of life is a lot better as long as your oncologist is keeping up with those discoveries that are being made. You want an oncologist who's going to be honest about your recurrence risk. There, in almost every single cancer out there, even early stage, there is a risk of recurrence. Most doctors don't talk about it, believe it or not. In fact, part of my advocacy is reaching out to people and saying, there's a 30% recurrence rate for early stage breast cancer. And in other cancers, it's a lot higher. For example, lung cancer has a 90% recurrence rate. Yet you have doctors who are removing lungs or part of lungs and stuff like that, when it's more than likely going to come back later. So you don't want a doctor who's going to say, okay, you're cancer-free, go live your life. No such thing as cancer-free. There's no test that is sensitive enough to determine that. Nor should an oncologist use the word cure. That's a very controversial term in the cancer world as well. So be mindful of those things. And if you follow these tips, it'll really help you make sure that you're making the right decision for your cancer care or the cancer care of your loved ones.